Oral cancer often begins with subtle changes in the mouth that are easily overlooked. Leukoplakia, white patches, and erythroplakia, red patches, are the most common early signs, appearing in 85% of precancerous cases. These lesions are typically painless initially, which leads many to delay medical consultation. Studies show that early detection increases survival rates from 50% to over 90%. Regular self-examination using a mirror under bright light is recommended by the American Cancer Society. When discovering oral abnormalities, 72% of patients turn to internet searches before consulting professionals, according to Journal of Medical Internet Research. However, symptom checkers have a 40% misdiagnosis rate for oral conditions. Key terms like non-healing mouth ulcer yield 3.2 million results, causing unnecessary anxiety. Reliable sources like Mayo Clinic and CDC websites should be prioritized over forums. Remember that oral cancer represents only 3% of all cancers, though vigilance remains crucial. During clinical examination, dentists use toluidine blue staining, a diagnostic method with 78% accuracy, to identify malignant lesions. The WHO reports tobacco and alcohol cause 75% of oral cancers, while HPV-16 accounts for 20% of newer cases. A comprehensive exam includes palpation of lymph nodes, as 30% of oral cancers metastasize. Doctors measure lesions precisely. Those exceeding 2 centimeters have significantly worse prognosis. The Velscope fluorescent light system aids in early detection. Punch biopsies remain the gold standard for diagnosis, with 92% accuracy according to Oral Diseases Journal. Local anesthesia is administered before removing a 4 to 6 millimeters tissue sample. Pathologists examine cellular architecture. Severe dysplasia shows abnormal mitosis in basal layers. The procedure takes 15 minutes with minimal discomfort. Recent advances like liquid biopsy for detecting circulating tumor DNA show promise but aren't yet standard. Results typically require 3 to 7 days for processing. The TNM staging system classifies tumors by size, T, node involvement, N, and metastasis, M. Stage 1, tumors less than 2 centimeters, has 85% 5-year survival, dropping to 40% at stage 4. The pathology report details differentiation grade. Well-differentiated tumors grow slower. Molecular testing may reveal EGFR or P53 mutations guiding treatment. Surprisingly, 60% of patients experience relief upon diagnosis, according to Psycho-Oncology. As uncertainty diminishes, multidisciplinary teams then create personalized plans. For early-stage cancer, CO2 laser surgery preserves function with 2 mm margins, achieving 90% clearance. Advanced cases may require mandibulectomy, jawbone removal, with fibula flap reconstruction. Radiation therapy uses IMRT technology to spare salivary glands, reducing xerostomia risk from 63% to 29%. Radiotherapy and oncology. Emerging immunotherapy like pembrolizumab shows 15% response rates in PD-L1 positive patients. Treatment decisions weigh survival against quality-of-life factors like speech and swallowing. Microvascular reconstruction now allows 85% functional jaw restoration using fibula bones, Journal of Oral Surgery. Surgeons employ nerve-sparing techniques to preserve sensation when possible. Intraoperative frozen sections ensure clean margins, crucial as positive margins reduce survival by 50%. The average procedure lasts 6 to 8 hours under general anesthesia. Blood loss averages 500 milliliters, with 20% requiring transfusion. Robotic-assisted surgery is revolutionizing precision in hard-to-reach areas. Post-op, 60% of patients experience temporary dysphagia, requiring thickened liquids. Annals of Otology. Speech pathologists implement tongue-strengthening exercises that improves articulation by 70% within 3 months. Nutritional challenges arise. High-calorie shakes prevent the 15% average weight loss. Saliva substitutes combat radiation-induced xerostomia. Surprisingly, 40% develop new culinary preferences as taste buds regenerate differently. Pain management combines gabapentin with non-opioid alternatives to avoid dependency risks. The cancer support community reports group therapy reduces depression rates by 35% in oral cancer patients. Caregiver training includes recognizing chemo brain, cognitive fog, affecting 50% of patients. Mindfulness apps like Headspace show 27% better pain tolerance in clinical trials. Financial navigators help manage average $60,000 treatment costs. Survivorship programs address unique concerns. Dental implants wait 12 months post-radiation. Social media communities provide 24/7 peer support, unavailable clinically. 5-year survival rates now reach 65% overall, up from 54% in 2000. SEER data. The Oral Cancer Foundation emphasizes monthly self-checks. Look for color changes, texture variations, or non-healing sores. HPV vaccination prevents cancer-causing strains. Gardasil 9 covers 90% of oncogenic types. Dentists recommend annual oral cancer screenings, as 10% of patients have no risk factors. Survivor stories prove early detection enables full recovery. Share this knowledge to save lives. Remember, your mouth tells your body's story. Listen carefully.